Hi everyone, and welcome to week 6 screencast here. As you can see here, this has to do with a conflict. I did send out an announcement yesterday to have you do some self-assessment, which I think will be marvelous to bring back to our gathering together on Friday to talk about. But ultimately, when I do the semester 2 class, and when I ask about what students are looking forward to, they always talk about conflict. I think as a general sort of perspective, most of us struggle with conflict. We don't like it. Makes us feel uncomfortable, but unfortunately, we can't avoid it. It pops up in the weirdest of places at times, and it's something that we need to consider when we're doing these tasks of interprofessional work. We're coming across different personalities, we're coming across different professions, and we seriously have to consider how do we work with conflict and how do we achieve outcomes both for ourselves and also for our patients. So we're going to think about, what is conflict? What are the types of conflict? What's the advantage of conflict, and what's sort of disadvantaged in having a conflict? Doing an assessment, and then of course conflict strategies. So, it's sort of this idea of this boxing match, or this confrontation. That's what most of us think about as conflict, is this whole idea of I'm right and you're wrong, and I'm right and you're wrong, and this back and forth, and then nothing comes out of it that's any good or positive. This is our belief in conflict, but I would suggest that out of conflict, a lot of great things can happen. A lot of change can happen. The possibilities of looking at conflict from a different perspective, all these things come out of working with conflict and moving forward with it. So, what is conflict? I would ask you yourselves, to just take a moment and think about what conflict means to you, and write down a moment of reflection into what you think conflict is. So pause the video for a moment and think about your definition of conflict. I know it's here in front of you in the screen, but be honest with yourself. What is conflict to you? What do you feel it is in regards to your experience and your definition of it? So take a pause for a moment and write that down. So when we look at sort of the dictionary version of it, it's a fight or battle or war or an armed conflict. So with this whole idea of aggression and beating up and that kind of stuff. It can also mean competitive or opposing action of incompatibles. So an antagonistic state or action as of divergent ideas, interests, or persons. In other words, a conflict of principles. So think about what it means to be antagonistic. It's this whole idea of opposing or opposition of two conflicting philosophies, or the opposition of two individuals battling, whether it be fighting, or whether it be swimming for time, those sorts of things. Mental struggle resulting from incompatible or opposing needs, drives, wishes, or external or internal demands. So this whole idea of feeling conflicted over something, and we think about that from an ethics perspective, right? That when we're feeling conflicted about something, we're being ethically challenged. We're finding an ethical, sorry, I sneezed there. An ethical conflict or an internal conflict. And last is the opposition of persons or forces that gives rise to the dramatic action in a drama or fiction. So the first three sort of have to do with us, especially the third one. It's when I say the first one, you might go, well, what? And sometimes we're afraid, because we think that this is going to become a session of conflict, or an experience of conflict is a battle. It's a fight. It may not be armed, where you have tanks and guns and those sorts of things, but it becomes this sort of fight or battle over conflicting philosophies or beliefs. So when we look at it from conflict from a perspective of what we see, and asking ourselves what's really going on, And the reason for the slide is, underlying issues, what really matters, justification, and speak responsibly. So we know that when we're in conflict with someone, there may be underlying factors that we're not aware of that has the other individual or others sort of fighting back, and the conflict is arising because there's other things going on that we're not aware of. So when we look at how do we speak in conflict, how do we ensure, because ultimately what we're after in a conflict situation is we want to diffuse it. We don't want it to go up, ramp up, nor do we want it to remain the same if you're finding yourself sort of at a loggerheads of a discussion, and both of you are just not sort of finding a common way. So we have to sort of diffuse it, get it back to where we can have conversation around something. So the acronym is called VOCAB, which is thinks about vulnerability, communication, acceptance, and boundaries. So these are some things that we need to think about when we find ourselves in the middle of a conflict. So when we think about vulnerability, what does that mean to you in terms of speaking and communicating with someone? Think of a conflict maybe you've had recently, or maybe something that still sticks in your mind from your past. Where was the vulnerability in that conversation? Was there any in terms of where they're feeling in light of their position? So are they feeling vulnerable within it, as far as you're speaking to them? Are you recognizing that? Communication, obviously the number one thing would be to make sure that both of you understand each other, which at times does require you to step back and stop and listen and to be respectful to the other person's position. And possibly acceptance. We go all the way back to this taking different positions and trying to understand someone's position in light of this conflict, is maybe the acceptance of that there is a difference of opinion here, and that there is the opportunity to learn from that, and that nobody is right or wrong. Maybe both parties are right, but accepting each other's positions in it. And of course, maintaining boundaries. That could be physical boundaries or emotional boundaries. So when we think about conflict management in light of patient care, because there's always the potential for conflict within that professional relationship, quality patient care is linked to healthy working relationships amongst healthcare workers. So our ability to be able to work together appropriately in interprofessional environments, multidisciplinary clinics, is vital to the patients receiving quality care, and it requires that everybody is feeling okay to state their opinion about something, but at the same time are willing to understand the other person's position as well. If we find ourselves in a position where we have unresolved or mismanaged conflict, that results in showing up in light of what the patient sees. And again, take a moment and think about an experience you may have had at an office where you visited, where you are working within a healthcare setting, and maybe the individuals come in to have a discussion with you or to do an assessment with you, and now they suddenly are going off on the other individual, about the other individual who had just been in the room with you, and so forth. So that doesn't allow itself for you as a patient to feel comfortable that everybody is working towards the benefit or the care that you require. And that may result in you not returning back to that clinical environment because you don't feel that you're getting the best of everybody. The thing is about conflict, we all consider conflict to be negative and nothing coming out of it other than, everybody being angry, nothing being said. We have to start thinking that maybe conflict is an opportunity to allow for growth and understanding. So conflict can be used to, or advantage, mutually understanding and vetting all the possible options. So when we're finding ourselves in a conflicted situation with say, another professional, and you're standing behind the fact that massage says to do this, that, or the other thing, and the other person across from you is a chiropractor, and the chiropractor is saying, well, I believe that, chiro says that it can do this, this, and this, and I think it's better for the patient. Out of that, if you can achieve some mutual understanding of where you're both coming from, this starts to open up the ability of a much larger possibility of options for the patient for resolving their problem within a treatment plan and so forth. So maybe, if we use chiro and massage, maybe particular soft tissue techniques and then adjustments may be at the end of the day the best thing for the patient. But if you both find yourselves sort of standing strong in your beliefs and not listening or wanting to accept someone else's position, you can see how that may lead to not giving the best that you can to your patient. So let's talk about communication. It is the skill that can possibly have the greatest impact on effective healthcare delivery. It really is the key to clinical governance and demands as much attention, respect, and sustaining as other seemingly harder targets. However, often the mere mention of the importance of communication causes less than positive reactions in healthcare professionals. So what I want you to think about is, if communication is so important, then why do we lose the ability to communicate well in certain situations? Why does this statement of the mere mention of importance of communication causes less than positive reactions? What is the reasoning for that? Why does that happen when we talk about, you need to communicate better and communication is the key? Why do you think people are so nervous about that, so concerned about that? I'm going to talk a little bit about this on Friday, but I want you to think for now, to bring to class on Friday, why do you think people are so afraid of communication? Now, when I want you to just take a moment here when I say this, I want you to write down words that come to mind when you hear the word conflict. I'd like you to write down anywhere from 5 to 10 words that suddenly just come to you very directly when you hear the word conflict. So please pause the screencast now and then write down those 5 to 10 words that represent to you conflict. So I hope you came up with a few words here, and I'm going to be bringing this up in class for sure on Friday to get a sense of some of the words that some of you came up with. So please keep these words close at hand because we will be talking about them in class on Friday. So when I asked you earlier about a definition of conflict, what do you think about conflict when you initially come up with that word, and how do you sort of define it? And when you take a look at your definition of conflict, the question you ask yourself is, that definition you've come up with, how does that look when we think about how it shapes out for you if you find yourself in conflict? So if, it could be that through your definition you're afraid of it. It could be through your definition you don't want any part of it. And, what I've sort of alluded to is some good things can come out of conflict. So we have to start thinking about that. If you are avoiding conflict, you could be missing out on a lot of growth, and you need to start thinking about, how do I use conflict? Again, your definition, how does it sort of look at when you think about the way you react? So if you find yourself in conflict, will you suddenly run away? Will you emotionally or mentally shut down? And because you don't want to find yourself in that position. And I think, although the question says here, are there negative consequences of conflict? I would be willing to bet that most of you would have a fairly long shopping list very quickly of all the negative consequences that you think conflict would bring. If I were to ask you to list the positive consequences of conflict, I feel that some of you might really struggle to see if there is anything positive that comes out of conflict. So take a moment, again, pause, and write down a few things of what is negative, what you think is negative consequences, and try to come up with a couple of things that you might think might be positive consequences of conflict. So what is it? Basically, it's an expressed struggle, and that can be a struggle between two people, but it can also be, as I said earlier, could be a conflict internally within you as well. Conflict is about goals the parties see as incompatible. And as it says here, it could be real or imagined. So again, if we think about second semester when we started looking at biases and assumptions, we may look at someone and already think we have a conflict with them simply because we have placed an assumption on them, which results in an imagined conflict before you even begin. Poor communication is key, and this is, a great example of poor communication is actually texting. How many times have you found yourself texting with someone and suddenly they seem to come back angry, and you are asking yourself, like, why are they angry? I just said this. Well, through that form of communication, it has been misinterpreted. That can happen just as easily in verbal conversation, that you have said something in a certain way or at a certain time that suddenly results in something being incompatible to the other individual. And conflict includes interference of goal attainment. So when we think about trying to move forward in something, conflict can be that if you are being prevented from it. And just put treatment in front of that word goal. If you've got someone that you're working for who you feel is interfering in your ability to have a treatment goal for your patient, or your patient is upset and is interfering with a goal, you can see where conflict can begin to arise. So if we look at things that can cause conflict in a healthcare setting, could be limited resources, could be staffing, not enough people, could be limited time to learn and communicate and discover, or it could be the technology is not there to help you, maybe computers or access to research and so forth. Different goals and expectations of work. So when you're working in an interdisciplinary clinic, your goals and expectations of work could be entirely different than someone you work with, and certainly could be entirely different from the person that you're working for. Within the context of that expectation of work, cultural diversity and differing points of view can also cause conflict. So, one example of the cultural part is, working with particular genders. Differing points of view could be where you're placed in an ethical position in terms of writing receipts and maybe trying to, or being asked to try to change the way that you document billing and so forth. Another differing point of view of conflict is within a clinic, who owns the files? Does the clinic own the files, or does the therapist own the files? And these are common sorts of conflicts that I hear about within the context of massage. High involvement work settings where collaboration is imperative. If you're expected to collaborate and you have someone that you just, for whatever reason, you don't like, or you completely disagree with their focus or their mode of treatment, now you start to get into the possibility of conflict because they're not following your way and you're not following their way. And that can be a problem. The other thing is varying degrees of knowledge. So you can see where you may come forward in your early days of clinical experiences and you are a fairly new graduate and you're working with someone who has 15 or 20 years of treatment practice. You can see where there might be conflict in the approach. And that doesn't always mean that the person with 15 years of experience is better attuned to what is required. They could be the type of individual that is not keeping current. And you coming out of school may have something that they know nothing about. And you're coming from the position of some knowledge that you have that maybe didn't exist when that individual went to school and hasn't furthered their knowledge base. So don't always assume that because you are fairly new that you don't bring anything to the table. So remember, it can go both ways. So, myth number 1, conflict is harmful and should be avoided. And I have sort of alluded to this a number of times now through this screencast so far, that this is not correct, that things good can come out of conflict. Myth number 2, conflict is a misunderstanding or breakdown in communication. Doesn't necessarily have to be. right? It may not be a misunderstanding. It may be that it was communicated quite well, but you're still finding yourself in conflict. So when we look at myth number one here, they can help understand. It can help having a conflict within a conversation with someone else can help you understand the issues more clearly. So working within that uncomfortableness of conflict allows you an opportunity to kind of just listen for a moment, and instead of ramping up, maybe the other person is expressing an issue that you hadn't thought of before. And quite often in conflict as well, when you have something around issues, sometimes ego gets in the way. So you are damn determined that you're right and you can't possibly be wrong, or you don't want to move forward with something. If you take the time to listen to someone else, you may get the idea of the issue at hand for them, and then through collaboration, you can work with that person to achieve an outcome. Can also help improve group decisions. I mean, you can imagine me as a coordinator with 13 people in staff, that there's likely conflicts that happen quite often within the context of a team meeting, and if it's worked appropriately, then it helps the whole group work together. I like to, within the context of working with my staff in the massage program, I like to keep an open forum where people can state how they feel about something, which quite often in meetings, there are minor conflicts that happen, and we have discussion around it to better come to group decisions. Conflict can also increase member involvement, and it does, because sometimes out of the corner somewhere, someone may have a comment about something that's conflicted, and suddenly no one thought of looking at it from that perspective, and it gets everybody thinking differently. Conflict can increase cohesiveness, and that may seem counterintuitive to you, but within conflict, people can start to work together better, because now they're starting to understand each other. They're starting to see each other's way of thinking, philosophies of moving forward, and so forth, which helps increase cohesiveness. So, again, I'm saying a lot of us are very uncomfortable working with conflict because we have a particular way of looking at it, and therefore is not great. It ends up with harmful things, and I'm telling you that in a lot of ways, if worked right, it does not. Myth number two, in the communication breakdown. You can have great communication between two people, but now you have a difference in values, which is resulting in the conflict. It has nothing to do with communication. It has everything to do with my belief system and someone else's belief system and what we value, and we're finding conflict in that. Conflict can occur over having different goals and methods of achieving those goals. So sometimes, again, in team meetings, I may have a way that I want to move forward, and that conflicts with what someone else wants to do to move forward to achieve the same goal. We both agree we want the same goal at the end of what we're looking at, but my way, for example, of wanting to do it could completely conflict with Sarah's way of wanting to do it. So this is where it gets out in the open, and we recognize that there's different ways to do it, and then we work on it, and we come up with what the whole team wants to, the whole team recognizes they want to achieve the particular outcome at the end, but we work on what steps do we take to achieve that outcome. Conflict can also occur over limited resources. So, when we're looking at someone may have some resources at hand to make a decision or have a question about something, and others may not have access to those particular resources, and they're coming from their perspective of what they know and what resources they've had. The other individual may have more opportunity at resources and are saying something else that they know based upon what the kind of resources and knowledge they have, and there's a conflict because there's misunderstanding between the two. Ultimately, again, if you think about the communication happening appropriately and working together as a group within group decisions, we start to recognize that someone may not be informed enough because something has changed or something has moved forward and they're unaware of it. So it's about working together in regards to finding that same thing. So how do we frame it normally? Conflict is a war. It's a trial. It's a struggle. It can be an act of nature. It can be a game, it can be at a bargaining table, it can be at a dance, or it could be a dance in terms of how you work together, and sort of taking your position and discussing. Conflict is a garden. So we look at war, trial, and struggle, we start to think of it very negatively. If we think of it as a act of nature, a game, and a bargaining table, we start looking at things can come out of it. So it's natural that we have conflict. It could be a game between people. Everybody knows what's going on here, but they're having a conflict between positions. If we look at a bargaining table where we might have a union working with their membership and administration or management, there's conflict that's happening there. And quite often the bargaining table and the game come together. You have two opposite sides here within a bargaining position. Both know where they kind of need to get to in the middle, but both must actually be very strong in their positions to begin with. So it ends up in a dance where they're working together to try to come together. And then conflict as a garden means that out of this soil, out of this conflict can grow many, many, many things. So many plants and flowers. So it gives you a sort of an example of, the diversity of change that can come out of it. So I have a question for you in terms of 2 words, destructive versus constructive. Take a moment to think about what the difference is between the two. What sort of constitutes something being destructive and what constitutes something being constructive. So destructive is I-oriented language, all about me, that is dominating, escalating, retaliating, competing, defensive, and inflexible. So if we think about that perspective, then if we find ourselves in a bit of a conflict and everything is about I-oriented language, we have a problem, because if we take the position of I, it's likely others will take the position of I as well. Constructive is we-oriented language. So when we think about we in terms of a discussion, generally we tends to be more de-escalating, represents somewhat being cooperative and supportive and flexible. So the next time you find yourself in some sort of conflict, think about what the other person or what you're saying, or even within yourself, if you're having a self conflict, is everything I, or is any part of it we? If you're finding yourself in the I position quite often, then that's when one needs to think about getting this into a constructive form or direction, so we start thinking about we. So when we think about constructive strategies when we're in a conflict, obviously we're looking at an open type of communication, respectful type of communication, and this allows for collaboration. One thing that will de-escalate conflict very quickly is collaborative conversations and collaborative philosophy. So when everybody's being collaborative, and part of collaborative is negotiating. Part of collaborative is, finding equal ground to some degree within whatever the conflict is you're having, which sometimes is very difficult, but finding common ground is the utmost, because finding common ground allows for this respectful communication, and this is what's going to allow for more constructive work. Healthcare providers develop a deeper understanding of each other's roles and responsibilities when respect and trust between team members is high. So part of the reason why we do IPE training is so that you can get a better understanding of what some of your peers may have in terms of their scope of practice, what kind of expertise they bring to, say, for example, helping a treatment plan. And the more that you understand their role and responsibilities, and they understand yours, again, this allows for much more respect and constructive work. The other part of that is, sort of as a segue, is understanding each other's contribution to patient care is essential. So this is the reason why we do a lot of this IPE stuff, is so that through an understanding of what other professions can provide for your patients, helps to achieve better treatment plans, more quality of care. So if you're doing an assessment on a patient and you feel that, yes, you can provide something for this patient, but an expertise that another healthcare practitioner may provide as well, will even further improve the quality of care, and therefore compliance, and therefore better outcomes and treatment plan is of the utmost of what we want. So there are three types of conflict things that can happen. So there's a task conflict, there can be a relationship conflict, and a process conflict. And they kind of, if you think about what they're saying there, they sort of speak to themselves, but we'll work our way sort of through them. The four-way taxonomy of conflict regulation strategies in teams is forcing, yielding, avoiding, and problem solving. So when we think about regulating conflict, we think about these four things. So when we consider conflict and how it can work in teamwork and collaboration, generally what we tend to do as healthcare practitioners is we look at conflict as a symptom to be treated and eradicated. And we don't take the time to look at its root cause and find what Eichbaum says is innovative potential. So we have this first and foremost feeling that it's a problem, it's a disease, and we need to treat it and eradicate it. And as we've talked through in the last number of slides, a lot of good can come out of it if it's approached appropriately. So we want to cultivate psychological safety, so we want interpersonal risk-taking. So again, in my team work with my staff, I want them to take risks. I want to create an environment where they feel safe and they can say what they feel without any retribution if, in fact, it is sort of conflicting to what's happening at the conversation at the table. And through that, then we find innovation and expansive learning. So when we look at this idea that we allow people to take risk, we allow people to feel comfortable, to not go along with the norm and think more innovative, that's not seen as conflicting, but in fact is actually an opportunity for innovation. Democratizing hierarchy of power through educational curriculum changes. So the idea being that, we're very much stuck in everybody in their roles in healthcare, right? Chiros supposedly know more than we do. Doctors know more than anybody else, and on and on and on. We have this hierarchy of power, and if we can create an environment where democratically we can work together towards the greater good of our patient, it's going to create an environment where we're going to get much higher quality outcomes from our patients. So when we think about all these things that may come up when we look at some of the challenges within relationships in the healthcare environment, when we get into conflict, it can become an obstacle if we don't work with it properly, and this can result in negative things occurring rather than positive things. So we have to think about removing the distractions. So the task or the relational and sort of things that are happening between people, and then the process itself. Is it following process? Is it not following process? And as I said previously, cultivating psychological safety is the utmost. People need to feel comfortable with saying things that others may find conflicting. Because as we said previously, this is where innovation comes from. And the other thing that is hard for a lot of us is looking at the positive attributes of the conflict that you're in. So taking that reflective time to look at a conflict that you're in the middle of, and even though things are look like they're kind of heading east, taking the time to reflect on what can positively come out of this bit of conflict that's happening. And the other part is removing the power hierarchy. I've never thought of it this way before, but in my management style with staff, I try very hard not to have a power hierarchy. This does not mean that at times the hierarchy has to make a decision on something. That does occur. We can't avoid that. There are reasons for that, and we have to understand that that can possibly happen. But you can't find yourself in a kind of power hierarchy in a conflict, say for example with a patient. So taking that position of power hierarchy in the relationship with your patient in a conflict situation will become an obstacle. So you have to sort of convey to the patient that they can feel safe to say what they want, that you're taking the time to understand it and letting them know that you're hearing them and you're listening to them. So this is all part and parcel. I mean, a lot of these slides are set up for relationships professionally in a multidisciplinary clinic of some kind, and they play a big role, but they can also help with a patient. And frankly, they can also help in your private life as well. So when we look at this self-assessment and management styles, like I sent out and I've asked you, is to complete these two assessments. The first is a conflict-provoking communication self-assessment, and the second is a conflict management styles questionnaire. Please do these for Friday, and we're going to use these and have discussion around what you found from that, and whether you agreed or disagreed, and having a look at just how do you deal with conflict, how do you manage it, and those things that you may say in a conversation or communication that you don't think of as provoking conflict, but maybe they are. So please take the time, make sure that they're done, and bring them to class completed, please. Now, these are embedded videos, and I don't think they're working. I'm going to minimize this just for a moment and see if I can figure this out. Hi, sorry guys. I attempted to look for this video because, as you know, I can't play them or I lose my ability to publish them. It's called Finding Confidence in Conflict by Kwame Christian. You should be able to watch it on here. I hope that you can. If not, there are a couple of other TED Talks you can look at. So please take the time to listen to this. It's quite good. It's the title is called Finding Confidence in Conflict. He speaks quite well of the fight or flight and also the freeze response that we have in the brain when we find ourselves threatened or we're fearful. So it does help a little bit with thinking about why you react the way you do or how you react the way you do when you're feeling some conflict. That's the end of this slide. There was another slide I'm going to throw on here, so I will just pause here for a moment and come back to show the next slide. Actually, folks, I'm looking at the slide set. I think I'm going to actually do that slide set in class on Friday. It relates to one of the questionnaires you're doing. So again, I'll be doing that slide set on Friday this week. Thanks for listening, everybody, and we'll see you on Friday.